after the awful death toll and pressure on the health system in Jakarta, other parts of Java and Bali due to the Delta variant, and with signs of cases spreading to some more remote regions and other worrying issues. So without further ado, I'd like to open the floor to the professor, and thank you for talking to us today.
Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon. Big thank you to our friends in the media who have joined us today in this briefing, including Mr. Jaktv, as we have done various times in the past. And today I will be providing an update regarding COVID-19 management in Indonesia. And I will start today's session with a brief presentations on Indonesia COVID-19 management as of August 2021. Afterwards, we'll move forward to Q&A sessions. And to begin the sessions, please be informed that the government has decided to extend PPKM level 2 to 4 in both Java Bali and also non-Java Bali areas. And based on the instruction of the Minister of Home Affairs, number 30 of 2021, the PPKM level 2 to 4 in Java and Bali has been extended from August 10 to August 16, 2021. Meanwhile, based on the instruction of the Minister of Home Affairs, number 31 and 32 of 2021, the implementations of the PPKM level 1 to 4 outside Java Bali has been extended for 2 weeks, starting from the August 10 to August 23rd, 2021. And moving forward to the case development in this country, given that PPKM level 4, 3, 2 is still valid until August 16, 2021, it is important to continue to evaluate the weekly development of COVID-19 cases so that we can jointly monitor our readiness towards gradual opening. And then positive cases witnessed a decline this week compared to the previous week from 273,891 to 225,635, or equivalent to a decrease of 48,256 cases. This is the third consecutive week that has shown a decline at the national level, and it's a good development that must be maintained. It is also important to remember this weekly decrease in positive cases must be followed by a decrease in the positivity rate and an increase in the testing, so that this condition does not become a false improvement. Unfortunately, testing this week experienced a decrease based on WHO standards from the previous 402.96% down to 354.38%. Meanwhile, the good news is that the weekly average positivity rate has also decreased from the previous week of 25.18% down to the 23.57%. Nevertheless, the government will still need to continue PPKM level 4 to 2 because even though cases have decreased, the number of cases is still relatively high when compared to the situations before the spike. And previously, our daily positive cases ranged from 5,000 to 7,000 cases, while currently it is still at 20,000 to 40,000. And we must strive to reduce this number. In more detail for the provincial level, several provinces are still experiencing a fairly high increase in positivity rate as we enter the 6th week of PPKM levels 1 to 4, and the 5 provinces that contributed to the highest number of cases are East Nusa Tenggara, adding 2,303, and then Central Sulawesi, adding 1,733, and then Bangka Belitung, adding 982, and then South Kalimantan, adding 624, and then West Sumatra adding 587. All of these 5 provinces are outside Java, Bali. And some of these provinces, namely Central Sulawesi, South Kalimantan, and also West Sumatra, also rank 2, 3, and 4 in terms of highest number of positive cases. Moreover, North Sumatra, adding 5,425, ranked first, and South Sulawesi, adding 1,786, ranks 5th. And the good news, however, is that active cases at the national level also fell the second week in a row by 17% from the peak on July 25th. For this reason, to further reduce the number of positive cases and active cases at the national level, we must focus our management efforts in all provinces, especially provinces outside Java, Bali, given the relatively high increase in positive cases and also active cases there. For the 5 provinces outside Java, Bali mentioned previously, their respective governors and mayors and regions are requested to prepare health service facilities in their region to control the spike. We humbly request the governor in charge to constantly update themselves with the case data of their respective regency and cities to ensure quick follow-up and prevent further unfavorable developments. And we have been dealing with the COVID-19 pandemic for 1.5 years now. And we hope that given that fact, regional leaders are able to read the data more carefully in order to anticipate the increase in cases and prepare the best COVID-19 management strategy for their respective regions. For example, if they see an increase in positive numbers, regional leaders must immediately observe the number of the available beds in hospitals to monitor the hospital capacity in their area and provide the maximum effort to resolve the issue. Once again, the ability of local governments to read and understand the data is crucial in regional COVID-19 management. Next, the other good news is that the recovery rates at the national continues to increase after a sharp decline during the last spike in cases, set at 84.14% this week and 78.6% previously. At the time of the spike in cases, this also indicates an increase in recovery rates for the 3rd consecutive week. And I would like to thank all health workers who have struggled to serve patients so far, especially in the last 7 weeks. 5 provinces with the highest increase in recovery rates this week are Banten, adding 12.12%, and then North Maluku adding 7.48%, and then Bengkulu adding 6.54%, West Java adding 6.01%, and East Nusa Tenggara adding 5.89%. I also express my gratitude to all regional heads, especially from these 5 provinces, who are quick to act upon the situations and monitor the needs of health service facilities in their respective regions. Unfortunately, the number of deaths has not shown a significant change and has continued to increase in the last 3 weeks. Deaths at the national level need to be seen in percentages to prevent bias, as they are affected by the rise and fall of positive cases. Meanwhile, to see death at the provincial level, you can look at the rate of increase in order to be able to assess which provinces need to be addressed immediately. This week, the death rate is at 2.92%, or close to 3%. Comparatively, global death rates at 2.12%. And the 5 provinces that contributed to the highest weekly increase in death are Riau, and then North Sumatra, South Sumatra, Bangka Belitung, and also Central Java. Therefore, apart from focusing on reducing active cases, reducing deaths also needs to be the main objective behind the extension of the PPKM. The spike in death rates in the last 3 weeks in a row has certainly been a massive loss for the Indonesian people. And in the month of July alone, we have lost 24,496 lives, with an average daily death of over 1,000 people. All regional governments are requested to seriously give their best effort in reducing this death rate by continuously monitoring the availability of beds, medicines, ventilators, and other medical devices at every COVID-19 referral hospitals in their area. And please coordinate with the center or central government if you need emergency assistance. With the isolation room bed occupancy or BOR rate continuously declining, this week the national BOR rate was 54.35%. Mortality rate should ideally also be on a decline, as less people required hospital treatment. What needs to be considered is that people who are self-isolating at home must continue to be monitored through the RT or RT-RW, who will further coordinate with the local command post or task force. And the head of the RT or RW can ensure that its residents infected with the COVID-19 are not treated too late and do not self-isolate at home if it is not possible. So that number of the death can be suppressed. With the BOR of the hospital having decreased, COVID-19 patients who are currently self-isolating at home can be transferred to a centralized isolation location or to a hospital so that they can be treated as quickly as possible. Next, I will provide an update regarding the implementations of restrictions on community activities or PPKM in Indonesia. And based on the results of a limited meeting, PPKM implementations evaluations in Java Bali region will be carried out once a week, while the PPKM in Sumatra, Kalimantan, Sulawesi, Nusa Tenggara, and Papua will be conducted every 2 weeks, owing to challenges such as the area and capacity of the health infrastructure. I would like to emphasize certain revisions in the latest instruction of the Minister of Home Affairs as follows. Especially for PPKM level 2 to 4 in the Java Bali region. Revisions in the district and city level in the Java Bali region is due to efforts to improve data analysis through adjustment of leveling indicators. And this mortality data will temporarily not be used, keeping in mind the validity of the said data. Restaurants and also cafes in open spaces are allowed to operate with the same capacity restrictions, operating hours and health protocols detailed at level 3 and 4 areas and relaxed for the level 2 areas. And large cities at the level 4, such as Jakarta, Bandung, Semarang, and Surabaya, will hold a trial for implementing strict health protocols in shopping centers, malls, and also trade centers with the restrictions on capacity, operating hours, and visitor criteria as applied to the other level 3 regions as well. And places of worship are gradually opening with the capacity restrictions. And further arrangement for education in special regional special schools or SLB levels 2 and 3 with capacity restrictions and details of health protocols have been regulated. Especially for PPKM level 4 in non-Java Bali, the export industry can operate 100% with the implementations of strict health protocols, but must be adaptive to closing if a cluster of cases is found for the next 5 days. Places of worship are gradually opening with the capacity restrictions, and there is an adjustment in the number of the testing to be more adaptive to the development of the positivity rate. Special for PPKM level 1 to 3 in non-Java Bali or outside Java Bali, further arrangement for education in regional special school or SLB level 2 and 3 with capacity restrictions and details of health protocols have been regulated. And office capacity increases in the yellow zones at the level 2. And the industrial sector at level 3 can operate 100% with the implementations of the strict health protocols, but must be adaptive to closing if a cluster of cases is found for the next 5 days. And small-scale restaurants, cafes at level 3 and independent or in malls at level 2 with capacity limitations and implementations of detailed health protocols have been regulated. And places of worship with capacity restriction have been regulated. There is an adjustment in the number of testing to be more adaptive to the development of the positivity rate. And in addition, based on the results of this weekly analysis, there are no districts and cities that are at level 1 in Indonesia, and we hope that the situations will motivate each region to ensure better control. And once again, I need to emphasize that the policy changes made by the government are a form of prudence so that the community remains safe while still providing opportunities for the community to remain productive. And currently, the nation must support and help each other. Each of us has our own role in the pentahelix collaborations with regards to COVID-19 management. And the government tries to formulate the best policies. The media is an extension of the government to convey the information to the public, and the expert and academics as a critic while providing constructive solutions and suggestions that are suited to the Indonesia, and the private sector to participate in implementing the policy, while the community in general is able to carry out existing policies as well as possible to result in a positive impact. Next, I will explain the updated policy regarding the administrative requirements applicable in Indonesia for travelers, both domestic travel and certain international travelers who are allowed as per other applicable policies. In the following, I will highlight some revisions from the previous regulations, specifically for travel within the territory of Indonesia, namely travelers traveling by all modes of transportations are required to show a vaccine certificate, at least the first dose, as a screening method given that travel has been classified as a risk. Logistics and good transportation vehicle travelers and travelers with certain health conditions are exempted from these regulations. The travelers traveling by air mode must provide negative RT-PCR result with sample taken maximum 2 times 24 hours before departure, specifically for departure and arrival via air transport for inter-district or intercity travel within Java and Bali. Travelers have an option to provide antigen test result taken within 1 times 24 hours prior to departure, but must also complete vaccination and show certificate as a proof. Making COVID-19 negative result mandatory for traveling by sea, land, which is private and public, ferriage, and intercity train, namely RT-PCR test results with maximum 2 times 24 hours specimen collections or rapid antigen test results with specimen collections one time 24 hours before departure. And this method of screening can still provide flexibility for community to travel and officers in the field to carry out inspection. Especially for travelers with certain health conditions, they must replace the waiver for not showing a vaccination certificate by attaching a doctor certificate from a governmental hospitals. And specifically for international travelers entering the territory of Indonesia, proof of complete vaccination certificate is required at the screening stage in the arrival gate, with exceptions for children under or equal to 17 years of age. Especially for children aged 12 to 17 years, both Indonesian citizens and foreigners, after undergoing an 8-day quarantine and getting a second negative RT-PCR result. This is because vaccinations for the age range 12 to 17 are already available and permitted in Indonesia. International travelers over the age of 17 are required to be fully vaccinated, and vaccination facilities are only given to Indonesian citizens and foreigners holding diplomatic residence permits and official residence permits, or kitas or kitab holders. And travelers with certain medical reasons, both Indonesia citizens and foreigners, are required to attach a waiver from a government hospital doctor in their country of origin. Especially for foreigners holding diplomatic visas and service visas related to official or state visits of foreign officials at the ministerial level and above, as well as foreigners who enter under the Travel Corridor Arrangement or TCA scheme, with the principle of reciprocity, will be exempted from the showing vaccine certificates and quarantine for 8 days. And this is in order to provide flexibility for state activities, which are generally limited and occur only for a short period of time. In addition, if the second RT-PCR result that comes out positive, the options of comparative test is provided simultaneously by the Port Health Office in collaborations with the quarantine place. And to prevent differences in vaccination data on the dashboard, the Ministry of Health is currently trying to synchronize vaccination data with testing data in the new All Records system. For this reason, I must reiterate that policies design must be supported with the adequate implementations for it to result in a positive impact. I expect both field officers and the community can responsibly implement these regulations with the integrity. Do not be that person who finds loopholes in the rules or cheats. All policies are prepared solely for the safety of everyone. Lastly, I'd like to inform that the COVID-19 vaccine in Indonesia can now be given to pregnant women who are 13 weeks pregnant or in the second trimester of pregnancy and breastfeeding. And breastfeeding mothers in line with the recommendations given by the National Immunization Expert Advisory Committee before being vaccinated. Both categories are recommended to first consult about their health conditions with a doctor or health workers and must be in a fit condition to receive the vaccines. As directed by the President, Indonesia continuously preparing itself to adapt to the COVID-19 situations. It is something that all countries must coexist with in the not too distant future. Indonesia is currently preparing a long-term strategy in terms of a comprehensive national COVID-19 control roadmap that will cover the 3 pillars of COVID-19 control, namely the implementations of the health protocol, vaccinations, and the health service efforts, accompanied by a continuous learning process. All 3 will be carried out simultaneously to cover each other's shortcomings, including changes in people's behavior, the circulations of the vaccine doses, as well as the capacity of the health system. As the situation is dynamic, and we will continue to inform our media friends regarding our efforts in pandemic management. And we believe that during these uncertain times, all countries must focus their efforts on collectively fighting against the virus. When we must focus on both preventive and curative measures, given that previous experience has revealed vaccines and medical interventions will not be a success if we downgrade the importance of the health protocols. As a country who has experience dealing with the new COVID-19 variant, Indonesia strongly believes that solidarity between countries is an important tool that must be utilized to curb the effect of this pandemic sooner. And let us learn valuable lessons from each other's COVID-19 management strategy and offer a lending hand when needed. With this, I conclude my presentations and begin the questions and answer sessions. Thank you.
Now I'd like to open the question and answer session.
Thank you, Professor. We have several questions from our friends in the media. The first question is from Natalia Santi, Australian Financial Review. How is the planned booster vaccination for the people mentioned to be carried out in 2022? What vaccine will be used for this booster vaccination?
Okay, thank you from the Australian Financial Review. Thus far, the vaccine booster program is still prioritized for all medical and assistant medical workers, as well as supporting staff working at the health service facilities, or equivalent to over 1.5 million people in Indonesia. And this population is at risk or prone to recontracting the virus given their environment, as well as plays a vital role in COVID-19 management in Indonesia. And vaccine used for the booster is Moderna. And so far, the double dose of vaccines for the community is deemed sufficient, and the government is still focusing on equal distribution of vaccines for each province, especially those with a higher risk of transmission. Thank you.
Next question is, how is the development of the Merah Putih vaccine? Will the Nusantara vaccine not be used or retested?
Okay, at present, the Merah Putih vaccine is undergoing preclinical trials and industry preparations. Thank you.
Okay, how many foreigners have been exposed to COVID in Indonesia this year? Of these, how many have died, have recovered, and are still being treated? What are their nationalities?
At present, the task force will kindly refrain from answering these questions. Thank you.
The last question. How is the vaccination program for foreigners in Indonesia? How will the Gotong Royong vaccination program continue for foreigners?
Okay. Vaccinations program for foreigners residing in Indonesia continue to be carried out through the program schemes or free, which is especially for those over the age of 60, educators, education personnel, and certain foreigners, or through mutual cooperation schemes in accordance with the laws and regulations by involving the respective country's representative offices in its implementations. And vaccinations program for foreigners are prioritized for those who carry out domestic and international travel or mobility. In addition to that, the vaccination program is also carried out for foreign nationals who have recently arrived in Indonesia armed with the diplomatic residence permit and official residence permit, or KITAS or kitab holders, and who are between 12 to 17 years of age. Vaccinations will be carried out after they have undergone an 8-day quarantine and test negative for the second RT-PCR test. Foreigner vaccinations effort will be made in parallel with the government's main effort in accelerating national vaccination for optimal national COVID-19 control. Thank you.
Marshall Marriott International. Why is Jakarta still on critical level 4?
Whether we can hear you.
While active case number and hospital bed occupancy rates have decreased significantly?
Okay, so the questions from the Marriott International basically asking why Jakarta is still on PPKM level 4 while active case number and hospital bed have decreased significantly. Well, in principle, the indicators for adjusting public health efforts and social restrictions in combating the COVID-19 pandemic takes into account many aspects, not only active cases and bed. And weekly situations assessment currently in place to determine level of community restrictions in each district and city nationally are dependent upon transmission rate indicators and health response per region. And to determine transmission rate indicators, 3 aspects are taken into consideration, that is number of confirmed cases, hospital treatment, and also death. Meanwhile, to determine health response indicator, 3 aspects are taken into considerations, namely positivity rate, which is the number of the positive cases from total testing, tracing capabilities or contact tracing, and bed occupancy rate. A combination of the final 2 results will determine restrictions level in each district or cities. And finally, we must also keep in mind the mobility of agglomerations areas, as this can influence the final decisions. And I think that's the response from us.
We have one more question from Kate Lamb, Reuters. What is the government doing to support the regions amid spikes in COVID-19 cases and with fragile healthcare systems in remote areas? Why is the government now not including the number of deaths in PPKM decisions?
Thank you, Reuters. Currently, the government is trying to boost the capacity healthcare system evenly in various regions through the addition of centralized isolation facilities, especially outside Java and Bali Islands, increasing access to imported health equipment or materials for border areas, and equipping them with the new COVID-19 vaccination policies for vulnerable communities, which is the people with disabilities, indigenous people, residents of correctional institutions, and people with social welfare issues, and challenged Indonesian migrant workers, and other communities who do not yet have a population identification number or NIK. As for calculating the PPKM level, in principle, these temporary decisions has been made especially for PPKM in the Java-Bali region in order to achieve valid data for determining the right policy. As you may already know, the Ministry of Health is still focusing their efforts to improving the interoperability of national data. Although considerable progress has been made, certain challenges still exist. Synchronizing and harmonizing data across several states in real time continues to be a challenge, especially given that different regions have different systems in place. Moreover, different aspects of the existing patient criteria must also be recorded to get a comprehensive understanding of the situations. This, among other challenges, will inevitably result in delays. And please understand that no region intends to conceal data. The government's efforts with regard to real-time data is massive, and it's not something that can be completed overnight. Once we manage to do so, however, we can greatly contribute to the fight against COVID-19 globally. And we hope you understand. Thank you.
That was the final question. We will now open the floor from live questions from the media. Kindly list your questions in the chat section. Thank you.
Yeah. Ismira Lutfia from Arab News would like to ask about the discretionary steps that the government will take to address barriers to vaccines in certain population groups, such as foreign refugees and asylum seekers, which I think Governor Anis had requested, indigenous people who don't have identity card is another group such as this, and other vulnerable groups. I think this request has been made to the President, asking for the government to remove barriers to indigenous groups.
Okay, so basically the government of Indonesia is trying to put priority on the vulnerable areas, of course, but also to the vulnerable groups. As we prioritize those, we still give a lot of efforts to make sure that the vaccines should be available to cover the needing populations groups in Indonesia. Thank you.
Okay, and we have another question from Moses at Marriott International. How will the Indonesian government update the requirements for expatriates to show their vaccination certificates? For example, if an expatriate has his or her vaccinations in their country and do not receive a barcode for the vaccination, can immigration add the vaccination information upon arrival to a KITAS and receive a barcode? I suppose it's about aligning the different vaccination certificates.
Yes, we understand the situations in a global setting that not all countries have access to vaccines, and but in the same time we try to restrict the people mobility to avoid any imported case from other countries, and I think this is also happened with the other countries in terms of controlling the problems with the imported case. So therefore, we try to strict with the requirements to have the vaccinations, and we hope that people understand. So that's why those who will travel across countries, make sure that you have the vaccinations as well as meeting the objectives that is still limited, because we want to control the disease across countries globally. Thank you.
I just had a question about testing, actually. I think when we had the health minister on, he talked about a target of getting testing up to 400,000 to 500,000 tests, I believe. Now, obviously, we're hovering at a lot lower level than that. I just wondered, what is the situation with testing, and has the target changed, or is that still a target?
Yes, we still have the same target, but we want to make sure that the target will be met not only by the areas that have strong resources and health system, but we want to make sure that all other regions in Indonesia are also meeting that the targets. The redistributions of the target should be met to make sure that we can identify the cases across countries. Thank you.
Okay. I don't think we have any more questions in the group right now. I just wanted to follow up on the question about including the number of dead in the EPKM decision. Is there a timetable?
We don't know yet, but to see the situations based on the spike of the cases and a lot of delays in death reporting from several different areas. So therefore, we need to fix that problems with the coordinations between the central government and also the local governments who have that unsynchronized data and systems. So hopefully soon, when it's recovered, the system, then we will use that for the indicators. But we still report the death data to public every day. Thank you. Is there any other questions? It seems there is disconnections. If any other who joined this media conference, if you want to ask, please do so.
My apologies. I think I had a technical issue there.
Okay.
I'm very sorry about that.
Okay, no problem. Is there any questions?
Let me just check if one came in while I was crashed out. I don't see any more questions immediately. No, I don't. Anybody out there? I mean, you mentioned earlier about the shopping mall, the experiment currently going on with shopping mall and allowing, I believe, is it 25% or 20% of people in with vaccination certificates? What is the prognosis for that? Will it run for a certain period and then you'll assess it?
Yes, that requirements is a trial this week. And there are several challenges, of course, and this is part of the new normal that we are trying to exercise to make sure that the economy and health controls can work together, and we will ascertain once we have completed this week. So thank you.
Okay, so it's an experiment. It's a test right now to see how that operates going forward. Okay.
Okay.
Okay. Any other questions from anybody? Okay. Well, thank you all for attending today, and I'm sorry it was a bit late, but thank you again for your time, and we look forward to hopefully we'll hear from you very soon.
Okay. Thank you very much, Davis, and all of the foreign media. Thank you for your attention. I hope all of the explanations answer what you want to need. Okay, thank you. Selamat sore. Wassalamualaikum warahmatullahi wabarakatuh.